Children are now at the center of America's battle against COVID-19. Nearly 1 in 5 COVID cases during the last week of March were children under the age of 18. In Michigan, case rates among children have jumped significantly. On Friday, the Michigan Health and Hospital Association issued a statement saying pediatric cases in the state increased 237% since February 19th. CBS News correspondent David Begnaud reports.
Nice job, Piper.
These days, when 12-year-old Piper Seibert gets to run, it's in a rehab.
There you go. There we go.
She's going to the Children's Hospital and Medical Center in Omaha, Nebraska, to build back her endurance. For the last 2 months, Piper has been battling extreme fatigue.
Good job. Great effort.
And that is because she's a COVID long hauler.
It is scary because you don't know if you will do something that could make you stop breathing. It's just kind of a squeezing. It almost feels like someone sitting on your chest.
Piper's mom, Sarah, says her husband tested positive for COVID last November, but no one else in the family got sick. Then, one day in February, Piper was sent home from school.
She just went from a really active kid to a very lethargic, wore out.
We took an antibody test, and that proved that Piper had indeed had COVID at some point, though we don't know exactly when that was.
Dr. Jean Bauweg runs the Clinic for Pediatric Long Haulers. It treats about 10 patients like Piper every Friday.
Big breath in.
I think most of us would have expected that really symptomatic kids with acute COVID were the ones that were going to have symptoms for months, and that is just not what we're seeing.
The National Institutes of Health and the CDC are mounting a massive nationwide study of COVID long haulers, which includes children.
We don't yet have accurate data on how frequently that happens to kids.
For now, young patients like Piper have a long road to recovery.
I'm frustrated that there's not a cure for it and something that can make it go away. I don't get to do the things that I really like and enjoy to do.
Good.
So for more on this, let's bring in Dr. Susannah Hills. She is a pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center. Thank you so much for joining us. Should the increase in pediatric COVID cases in Michigan be a warning to other states of what's to come?
These cases of pediatric COVID, particularly the ones that result in that multi-system inflammatory syndrome, which are the worst cases of this, are just incredibly devastating. We've seen this at our children's hospital. Hospitals across the country have seen this, and we're seeing this increased number of cases in Michigan. So this absolutely is a warning call. It's not surprising. As you demonstrated in your numbers before, cases among kids in Michigan have increased 237% since February. A lot of these cases are mild, so let's stress that first. The most common symptoms that will show up in kids will be mild. But we've had over 3,000 cases of COVID in children in the United States. We've had over 300 cases of this MSIS, which is really severe COVID that lands kids in the hospital, and 70% of kids that are showing up with this super severe COVID syndrome, 70% of them are ending up in the ICU in Michigan. So yeah, it's a warning call, and it's a call to the rest of us that yes, vaccinations are going well, but numbers are going up in these hot spots across the country, and they're affecting our children now.
So, Doctor, why do you think we're seeing it now? Is it because of some of the activities that perhaps took place in early January? I mean, I'm trying to understand, like, where this spike is coming from, because every day you see the vaccine numbers increasing. Every day, more and more states and cities are opening up, but we are seeing these pockets where these spikes are troubling. And so I'm trying to figure out where they might have come from.
Sure, Vlad. Yeah, the answer to that is probably multifold. There are probably a few factors at play. The governor of Michigan was doing press conferences over the weekend stating the results of their look into why the numbers are increasing. And she certainly felt that increases in school sports and activities at school may be playing a role. That's not to say that being in school in a classroom using masks and doing the appropriate measures that we know protect kids increases your child's risk of getting COVID. That's not what she's saying, but they were thinking that perhaps the school sports and extracurricular activities were a factor. And we're certainly seeing that now the dominant strain is that B.1.1.7 variant from the United Kingdom, which we also believe affects kids more frequently and is more transmissible among children. So it's probably a couple of things that are leading to the numbers that we're seeing now.
So I want to ask you about some sort of news of the day when it comes to this virus. An Israeli study now suggests that the South African variant, or the variant that was first discovered in South Africa, may evade protection from the Pfizer vaccine to some extent. The study also found that the variant could affect vaccinated individuals more than those who have not been vaccinated. What level of protection do fully vaccinated people have against these variants?
That is the question, Anne-Marie. We don't completely know. We're still learning, but this does not change the take-home message that the vaccines that we're using now are all incredibly effective. So we've done the trials rigorously to show that all of these vaccines are effective. What we're seeing in this Israeli study, I believe, is just a real-life manifestation of what we were seeing a few months ago when in the serum studies that were done, when we were testing patients' serum who had been vaccinated against the variant strains. And what they found back then was that the antibodies from the different patients who have received the different vaccines had about a 6-fold decreased neutralization against the variant from South Africa. And so we're seeing here a similar thing, perhaps certainly in this group of 400 patients who were vaccinated with the Pfizer vaccine in Israel, there was a higher rate of reinfection with the South African variant. We're talking about among the cases of infection in those 400 patients, about 5% were South African variant, compared with overall a 1% of South African variant cases. So it seemed that that there was a higher number of South African variant strains in those who had been cases in those who had been vaccinated. But even still, this does not say that the vaccines are not effective against all of the variants. I think what's really interesting about these numbers is really important is if you read between the lines, what this study is also telling us is that there are people, and not in small numbers really, who are getting reinfected after getting vaccinated. This is a study of including 400 people who have been vaccinated who have been infected again. So I think that's also a takeaway from this study as well.
What kind of a risk does it pose, doctor, if you have been vaccinated, for example, with the Pfizer vaccine, and you are reinfected? I mean, before the vaccine, there were, as we know, looking at the numbers, there was a likely chance that you could end up in the hospital. What do we expect now? Should you be reinfected after you've been vaccinated if you're reinfected with a variant? There's a lot of variables, I get it, but like trying to, provide some information so that people don't, I don't know if people should,
Right.
a lot of the things that I think get reported, when somebody is just getting a little piece of information, in other words, a headline or something that they have to click on, then you get a lot of people freaking out. And so I guess the question is, if you've been vaccinated and you come into contact with somebody who has one of these variants, what are the risks that you could end up in the hospital or die?
Great question. So none of these trials promise that these vaccines were 100% effective. We're dealing with efficacy rates of around 90% for symptomatic COVID-19 for our best vaccines, Pfizer, Moderna. But there's still 10%, even in the trials or 5 to 10% in the trials of people who might get reinfected. And so with efficacy rates in the 90s, that's not 100%. We know that some people will get reinfected. But when we look at people who got hospitalized or mortality or death from COVID-19, that is approaching 100%. So what these vaccines do, they're highly likely to keep you from getting extremely symptomatic with COVID. They're almost completely effective in keeping you out of the hospital and keeping you from dying with COVID-19. And those are the results we really care about. 95% efficacy is wonderful for symptomatic COVID, but you get even higher than that and approaching, nearly 100% in terms of preventing death and mortality and ICU stays. So that's the takeaway. People may be getting infected, but we expect their infections to be less severe.
That's the news I wanted to hear on a Monday, Dr. Hills. Thank you very, very much for that. Appreciate it.
You're welcome. Thanks for having me, Vlad.